Deaths can occur in the submersion phenomena even without having the underlying pathology of the drowning. So we have to investigate for even the natural and the unnatural causes, even for the foul plays if we suspect them. And if we have any other clues for homicidal death or for the accidental death, we have to basically investigate very thoroughly whether the drowning was of an accidental nature, whether it was of a homicidal nature, or whether it was of a suicidal nature. We have to differentiate between all of them. So, deaths other than drowning, deaths from the immersion other than drowning are highlighted over here in this third section. Then, what is the underlying mechanism for the death, which is typically due to drowning? That is also basically sometimes it is a freshwater drowning, and then we have a saltwater drowning. They have their own mechanisms. And again, we even have a phenomena which is known as a dry drowning syndrome. So what is the phenomena and what is the pathology behind it? That is very important, and we'll be discussing that in this section. Then we have death in the bathtubs. Again, it can be of accidental, homicidal, and the suicidal natures, and we're going to discuss them in detail over here in these submersion deaths or in these drowning phenomena deaths in this section. Now, deaths from immersion other than drowning are very important. What is the underlying basic mechanism? It's basically the reflex cardiac arrest similar to the vasovagal inhibition. Now, this is basically the dry drowning syndrome which I was talking about. It's basically the vasovagal inhibition that takes place whenever the body comes in contact with cold water, and it basically produces a stimulus or a reflex action, and the cardiac arrest takes place. This is basically the dry drowning phenomena. And then there is another there can be another pathology behind it, and that is basically when even a little amount of fluid passes on to the trachea, there is a laryngeal spasm, and the asphyxiating condition takes place even before the fluid has reached the lungs and the hyperinflation of the lungs has taken place. So this is another again phenomena which is regarded in the dry drowning syndrome. So all of these pathologies basically come into play whenever we are investigating these drowning deaths. So, afferent arc is either basically the sudden immersion in the cold water. This was basically what I was talking about, the dry drowning syndrome, in which there is a sudden immersion in cold water. And what happens after that is there is intense stimulation of the cutaneous nerve endings. Now, basically, it happens in hot climates when there is already vasodilatation. This phenomena is more marked in such temperate conditions. So that will basically add on to this vasovagal inhibition phenomena, or this cutaneous nerve endings are more sensitive in that case. Now, alcohol is another factor that basically comes into play and potentiates such effects of vasovagal inhibition, or the cutaneous nerve endings are more sensitive in such alcoholic patients. So which is another predisposing factors in such drowning deaths. Now, sudden entry of cold water into the pharynx and the larynx, and perhaps in nasal passages, is another pathological phenomena that comes into play over here. They produce a powerful stimulation of nerve endings in the mucosa, and that is basically the cause for this vasovagal inhibition or the cardiac arrest that takes place after that. Now, bolus of the water is basically entering the trachea and is causing a reflex cardiac arrest. So these are basically the two pathology or the pathological processes that come hand in hand whenever we have a drowning phenomena at our hand or a submersion phenomena at our hand. Now, this diagram is basically a very comprehensive, it basically looks quite complicated, but it's very comprehensive way for the pathology that is underlying the drowning phenomena. So here I'll basically explain that the immersion or submersion in the cold, it's the mainstay over here. Now, what happens after that is this basically stimulates the cutaneous cold receptors. Now, it basically can take two ways over here. On one side, we can have a gas reflex and hyperventilation starts in that person. That basically causes an inability to hold breath in such people. Now, if hypocapnia occurs, there will be a decreased cerebral blood flow, And what will happen over here is that respiratory alkalosis will set in alongside. That will basically decrease the serum and the body fluid will be ionized in such cases. After that, the person will basically experience tetanic spasms and convulsions. It will be basically an epileptic episode for that person. And after that, what happens is over here, if after the decreased blood flow, there will be disorientation of the consciousness in some people. If there is an epileptic episode in such a person, or even if the person is unconscious, what will happen is basically the water inhalation will start, and it will end up in the drowning phenomena. So it is basically one set of reflexes that can set in after the cutaneous cold receptors have been stimulated. On the other hand, we can have a sympathetic nervous system activation as well. What happens after this sympathetic nervous activation is there can be a straight away autonomic conflict. And after this autonomic conflict, there is a break of the breath of the hold, and even a parasympathetic system activation on the other hand, in which the peripheral vasoconstriction is the underlying base cause that will basically result in hypertension, and arterial and venous pressure will also increase. That will result in the vessel rupture, a cardiovascular accident, CVA can take place, and basically all of these are again fatal for the person. Now over here, if we see after the autonomic conflict, what will happen is there can be straight away fatal arrhythmias, and that will basically result in the predisposing factors. The arrhythmias can basically increase the ventricular irritability, the myocardial ischemia, and there will be a decreased coronary blood flow, as well as an increased work of heart rate and increased cardiac output and increased filling pressures. And all of these is basically going to be stressful for the heart, and eventually they'll result in the cardiac arrest. A normal function over here can be simple. The person can get panicked. There'll be dyspnea. The difficulty in breathing is going to be there, and the person is going to panic in such a situation. What will happen after that is there'll be a swim failure. After the swim failure, what will happen is there will be water inhalation, and the drowning phenomena is going to set in. After this drowning phenomena, what is going to happen is the agonal gasps will start, and even the fatal arrhythmias we were discussing on the extreme right side will also result in the agonal gasps, and these agonal gasps are again going to result in the drowning phenomena. And the drowning phenomena again has the same pathology, that it can basically result in the vasovagal inhibition, that will result in the cardiac arrest, or it can result in the laryngeal spasm or the tracheal spasm, and that is going to result in an asphyxiating condition, which is going to be again fatal for the person. So basically these are all the factors. This is basically a play of factors that come into play whenever there is a submersion phenomena, and basically there is no clear-cut line between all of these pathological processes, which process has taken place and which not, but all of these basically contribute towards the death from the immersion other than drowning. So these are basically the factors that we are going to focus on whenever we have an immersed death. Death in bathtubs is another phenomena. It has its own causes. What can be the causes? First of all, we have to keep in our mind it can be of a homicidal intent, of a suicidal intent, and an accidental intent. It's not accidental in all cases, and so the causes can be immersion. Immersion is one of the cause. Another is suicide, as we were discussing. Homicides, we have to keep in our mind it can be a homicide, and we have to rule that out. Then we have the electricity is again another cause. It can be of an accidental origin. Carbon monoxide toxicity, in which we have the heating systems inside the washrooms or inside the bathing systems. So these basically carbon monoxide toxicity, in which the person first of all becomes unconscious, and then he has basically this immersion phenomena that basically sets in and basically causes the death of the person. So natural death of any other origin, that can again be of any cardiovascular accident or any other accidents or any other phenomena that the person already had, or any pathologies that he had already been suffering from. We even have to focus on these things as well. So in this section, basically we dealt with the underlying pathologies of death other than drowning whenever the submersion phenomena comes into play, and how are we going to investigate what pathologies came into play in different situations in our mind. So that is the end to this section. Thank you for watching sqadia.com.